You know that you're certainly tuned into the most comprehensive bulletin in the country. My name is Wilson Buru, and our sign language interpreter is Marisha Witi.
And I'm Nancy Kachungira. Thank you for joining us this evening. Let's begin with that controversial issue that we mentioned a few seconds ago. Adolescents aged between 10 and 19 could be provided with condoms and other protective devices in a new campaign against HIV and AIDS.
Now, the campaign, dubbed All In to End Adolescents AIDS, is spearheaded by 4 United Nations bodies and several private groups, and is seeking partnership with governments across the globe.
Well, it's aimed at providing contraceptives to adolescents in a raft of measures to cut the increasing rates of infection among this particular age group.
XKTN's Linda Ogutu now reports the launch of the campaign will be done in Nairobi by President Uhuru Kenyatta next week to accelerate the war on HIV among adolescents.
A lot of young people, a lot of young minds, and a lot of innovative minds because of HIV and AIDS.
If you look at AIDS-related deaths, we also know that of the approximately 48,000 deaths, 17% of those deaths are among adolescents. This is sort of the largest single largest, should I say, age cohort that experiences death, and we have also established that globally it is the leading cause of death. In Africa, it is a leading cause of death.
The reality on the ground that many have shied away from, the taboo topic in many homes that has now translated to the latest proposal for intervention by the National AIDS Control Council. The council says it's time the country did something to stop the AIDS scourge and sexually transmitted diseases among adolescents, many of whom are still in school. This journey, they say, will begin from giving adolescents contraceptives.
We're looking at 10 to 24 years.
The campaign, spearheaded by the United Nations organizations and government, aims to provide contraceptives to adolescents, including condoms, in a raft of measures to cut the increasing rates of infection among this age group. The campaign, dubbed All In to End Adolescent AIDS, is planning to promote a bold mass media campaign in order to address existing norms, attitudes and beliefs that are allegedly leaving adolescents vulnerable to being infected with the disease.
If there was healthy communication between us and our teachers and our parents, then I believe that would lead us away from risky behavior.
The council says targeting adolescents with condoms and other protective devices may be controversial due to social and cultural norms, but maintains it is a necessary move that could save thousands of adolescents grappling in the dark.
So I went to be tested, and I met the person who's doing the testing, and she asked me, "How old are you?" And I said, "I'm 16 years old." And "Why do you want to be tested? What have you been doing? What is these activities that you're engaging in? Where's your parent? Does your parent know you're here?"
Those are issues we don't talk about because we always say it's a bit too difficult to engage sexuality in schools.
According to the council, the race to reduce and eliminate barriers that are preventing adolescents from seeking and accessing HIV testing, treatment and care services could save the country millions of shillings.
We are also talking about a lifetime economic liability for governments, whether in the context of prevention, so that there is no transmission from those who are HIV positive, or in the context of treatment and lifelong treatment of ARVs, and the cost of that can be astronomical.
According to the latest data by the National AIDS Control Council, at least 16% of Kenyans living with HIV and AIDS are adolescents and youth aged between 10 and 24 years, or at least 263,000 people. In addition, almost a third of all new infections of HIV in the country are adolescents, while 17% of all deaths are in the same age bracket.